Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, U.S. life expectancy strides slow as nation's health ranking drops. The latest projections showing troubling slowdowns in U.S. life expectancy with significant implications for public health and LTC. Life expectancy in the U.S. is expected to rise by just 2 years by 2050, from 78.3 years in 2022 to 80.4 years. This stagnation will drop the U.S. global ranking from 49th to 66th among 204 countries. Female life expectancy is projected to decline in 20 states, and drug use disorder-related mortality is on the rise as well, with death rates expected to jump by 34% by 2050, more than double that of Canada. Disability rates are also alarming, some states reporting levels higher than any other country. Obesity is a major contributor to chronic disease and continues to escalate, with over 260 million Americans projected to be affected by 2050 as well. Even with improvements, the U.S. would still lag behind, underscoring urgent need for the systemic health reforms and stronger preventative care measures. Findings highlight a critical call to action for policymakers and healthcare providers to address root causes driving trends and health outcomes for Americans. Next, Medicare spending jumps 27% when patients leave Medicare Advantage plans. A new study reveals a sharp rise in Medicare spending with beneficiaries that leave Medicare Advantage plans for traditional Medicare, with significant cost implications for LTC providers. On average, Medicare spent 27% more, or $2,585 more per person, on beneficiaries who switched from MA plans compared to those who remained in traditional Medicare in 2022. SNF care accounted for the largest portion of increase, contributing 34% of the cost difference. Disparities across demographics and age were key factors, with costs rising dramatically for 85 and older. Dual-eligible beneficiaries who qualify for both Medicare and full Medicaid benefits experienced the most significant cost difference, with spending 61% higher after leaving MA plans. Findings suggest potential barriers to care within Medicare Advantage plans, particularly for services requiring prior authorization, such as SNF stays. Policymakers and HCPs need to evaluate long-term cost implications and access barriers associated with MA plans, especially for these vulnerable populations. And up last, facing twice the costs, lower pay, LTC pharmacists petition Congress for add-on fee, warning that without intervention, many specialty providers face closure. A new report from the Senior Care Pharmacy Coalition reveals that LTC pharmacies spend an average of $14.98 to dispense each prescription, more than double the cost for retail pharmacies. They're calling for a special LTC pharmacy service fee for medications subject to Medicare price negotiations. LTC pharmacies rely on margins from high-cost drugs to cover additional costs of providing generics and delivering specialized services to nursing homes, ALs, and other senior care settings. Services include enhanced medication management, patient-specific packaging, 24-hour delivery, and stringent quality controls. Recent Medicare price negotiations threaten margins, with particular strain on smaller, low-volume pharmacies in rural areas where dispensing costs can exceed $20 per prescription. Often the sole providers in regions are at the higher risk of closure. Closures could force LTC residents to relocate to facilities hundreds of miles away. Concerns are tied to the Biden administration's Medicare drug pricing reforms, set to take effect in 2026. While reforms aim to lower costs for individual consumers, they fail to account for unique needs of 2 million seniors relying on LTC settings. Many of the first 10 drugs subject to negotiated prices, including insulin and inhalers, are critical to residents. The SCPC's petition underscores the urgency of adjusting Medicare policies to reflect specialized and high-cost services provided by LTC pharmacies, ensuring access and sustainability for these vulnerable populations. Thank you for joining me for News This Week in Nursing Homes. To get more of QSource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your quality improvement needs, call the Q.